Welcome listeners to today's episode on AI-enhanced pharmacogenomics. I'm Dr. Sukant, joined by Bikram, a rising star in computational biology. Bikram, thanks for being here.
Awesome to be here, Dr. Sukant. This topic is really interesting.
Let's jump in. Pharmacogenomics, understanding how genes affect drug responses, is key to personalized medicine. It's complex, it's data heavy. How is AI boosting this field?
I will say AI is totally turbocharging it. It helps us decode how genetic variants shape drug outcomes faster and more precisely. Machine learning models like deep neural nets or SVM sift through genomic and clinical data to predict responses or risk. I read about a study where they used AI to predict warfare and dosing based on patient genotype. It cut adverse events by 25% compared to standard protocols, and that is huge for tailoring treatments.
25% reduction is striking. With so many genetic and environmental factors at play, how does AI pinpoint what drives AI drug response? What drives drug responses and how AI can pinpoint that better?
Right. So it's about integrating layers of data. You have got SNPs, that is single nucleotide polymorphisms, gene expression, plus lifestyle factors like diet. So AI models like transformers or random forest can randomly and can completely handle this complexity, weighing each variable.
That's precise. Data access must be hurdled out. Genomic data sets aren't always easy to come by, are they?
Oh, for sure. Like quality genomic data is gold, but it is very tricky. Public databases like thousand genomes are great, but can lack clinical context. You see, so private biobanks are richer but often restricted. And we deal with it by harmonizing data sets, aligning formats, filling gaps with imputation.
Harmonizing sounds essential. Another question: how do you ensure AI's predictions are reliable, especially for clinical use?
Trust, I will say, is non-negotiable. You can't gamble with patient care. We use explainable AI like sharp values to show why a model predicts. Say a dosing adjustment, maybe it's a CYP2 disc variant. I'm also pumped about combining AI with mechanistic models like PK or PD simulations. We did this for an antidepressant. AI flagged genetic risk for poor metabolism, then simulations confirm safe dose ranges. It's a double check that clinicians love.
Yeah, that combo sounds robust. Must take serious computing power.
Yeah, it's not light. Training on genomic data sets eat resources, but cloud platforms and efficient libraries like TensorFlow keeps it manageable. The tech is also evolving very fast.
Good to hear. Where is AI enhanced pharmacogenomics making a big difference? Maybe in a specific condition?
I will say mental health is a standout. Psychiatric drugs have widely variable responses. Genetics play a huge role in that scenario. So I saw a study where a Bayesian model predicted antidepressant efficacy using patient genotypes and EHR data. And it boosted response rate by 15% in a trial, helping doctors pick the right med faster. And that's a lifeline for patients stuck in trial and error hell.
Absolutely. That's actually quite a lot. Uh, I would not have thought of such a big improvement.
Mhm.
But let's think of not just this enhancement in mental health with pharmacogenomics. Um, what do you see broader frontier of this AI in this space?
So I will say I'm talked about real-time pharmacogenomics. Like imagine AI analyzing a patient's genome at the point of care, suggesting optimal drugs on the spot. We are already seeing multi-omics models blending genetics with proteomics. Plus, federating learning is letting hospitals share insights without compromising privacy. It's paving the way for truly personalized medicines globally, I will say.
But that's a game-changing vision. But there are two, three concerns. One is
Hmm.
doctors are bound by the protocol. I
Hmm.
saw that with a friend of mine, very close friend of mine, co-founder in one business. I'm not sure if the alternative would have saved the life, but there was enough literature. The doctors were like, this drug is not part of a thing for pancreatic cancer. When we presented the data, yes, but that's not the hospital protocol. So people, physicians, even if there is clinical data, if it is not part of the protocol, medical system today has huge problems with the legal liabilities in the US, with the insane patient pressure, like per doctor, how many patients are there in India. A lot of things are there. Europe is, in some regards, worse, in some regards, a lot better. Um, the monetary push is not as much. So there are possibilities, but and then there is over reliance on AI. So,
Right.
what do you think of over reliance on AI, and can it sideline clinical judgment?
See, I will say that's a trap. Like AI can never replace a doctor. So when you get sick, you should see a doctor and not AI. Right. So I have seen models over hyper prediction. Like one time our team flagged a perfect dose, but the patient's lifestyle threw it off. So clinicians caught it. The fix is, I will say, partnership. AI crunches data, doctors contextualize. Then you refine the model. We learned that the hard way, and it really keeps us grounded.
Well, I have mixed feelings on that. Maybe AI will replace doctors, but
Mhm.
as of now, the best thing is human AI collaboration. In future, whether uh, AI collaboration is much better than human AI collaboration, that is to be seen. But what are your final thoughts on AI enhanced pharmacogenomics?
I will say for now, it's rewriting personalized medicine, making drugs safer, more effective, tailored to you. And I'm just thrilled to help build tech that could transform lives.
Inspiring words, Vikram. Thanks for this deep dive, and thanks to the listeners for joining us. Until next time.